Hello and welcome to Very Nice Smile. I'm Dr. Rich. Today we're going to be restoring a cavity on the side of tooth number 22. So this is the lower left canine. Right there you can see the cavity and it's right at the gum line. So tooth's been numb with some septicane, and now I'm going to take my high-speed handpiece with I'm using a 245 carbide burr just to remove some of the enamel, expose the cavity, and then I'm switching over to a round burr to help remove the decay and drill into there. So in this situation where the cavity is right at the gum line, I suspect, based on talking to the patient, that the person has been drinking a lot of sugary drinks in between meals. So we discussed how to avoid doing this and put the person on some prescription strength fluoride rinse. But this tooth in particular, the decay was deep. It was through the enamel layer and into the dentin underneath. So the hole initially wasn't that big in through the enamel, but because of how dentin is, once the bacteria can get through the enamel and into the dentin, it'll actually leave a shell of enamel that's unsupported with dentin underneath. So there's decay underneath it, and it's just got a thin shell of enamel. So it's kind of, you ever seen a rust blister on a car fender underneath some paint? Same type of thing. The paint's still okay, but it's rusty underneath. So to fix it, you got to remove all that, clean up the decay. So now the tooth's all cleaned up, and now we're ready to start filling. First thing I use is some Clean and Boost to clean the prepped cavity again, just to help remove any schmutz on there. And it also is a mild etching too, so that'll microscopically roughen up the surface. So just brush it in there for 10 seconds or so, rinse it off, and dry it off. Now we're ready for the bonding agent. And again, I like to use Surpass, but we gotta put my yellow filter on because otherwise the blue wavelengths from my headlight will set up the material. So again, Surpass is a 3-bottle bonding agent. So first step is bottle number 1. That's applied for about 10 seconds or so. And that's basically the etchant, the conditioner, and then 3 layers of bottle number 2, which is the primer. So it helps neutralize number 1 and just gets the area ready for bonding. Once the 3 layers are on, you air dry it really, really well. Make sure you just thin it. You can't over dry it, which makes this, I find it makes Surpass very simple to use. And then lastly, place a layer of Surpass 3. This is the resin, the glue that holds it on. Now in this situation, because the filling is going to be very thin, I actually will thin it down with some air and then zap it with my curing light. I don't want like a really thick layer of that bonding agent because there's not going to be any room for the composite resin over top of it. So 10 seconds with the curing light. And again, in this situation, because of where it is and how shallow it is, I'm not using any flowable composite. So I'm just using the final composite. And a little bit different in this situation, I'm using a material called Omnichroma. It's actually a universal shade. It's translucent so that when you're using it in thin situations, it'll let the color of the tooth shine through a little bit. And it's actually kind of very interesting to watch. Like, you look at it, you don't think how can this work? You can put it on it'll take up the color of the tooth that it's on top of, and I find it works really well. And I also love the consistency. It's very soft and creamy, so it's easy to smooth in there. And I'm also, to place these types of composite fillings, I don't use my normal plastic instrument. I'm using this instrument that I'm using currently that you can see is actually a cord packing instrument. It's an instrument you use to place a little piece of thread in between the tooth of the gum when you're taking a crown impression. But I find the angles, the length of the blade makes it great to place composite in areas such as this, because the length of the blade is such that I can rest part of it on actual tooth structure, and then the bottom part where the composite is, I can shape it to fit the tooth. Now I'm just taking my Explorer and just running it around the edge just to remove any leftover bonding agent. I know that the composite resin is smooth because of how I placed it, and there you can actually see how it leaves like a little bit of dark staining. The metal leaves some dark staining on the composite. So I'll just take my Jiffy polisher in my slow speed handpiece and just buff that all off, and we're going to end up with a nice smooth composite resin filling that blends in and not going to be noticeable. All right, so thank you guys so much for watching. I hope you guys found this interesting. Please think of subscribing. Give me a thumbs up. It really helps out my channel. And we will see you in the next video.